Hi class, this is my daughter Julia with a G, and as promised she is joining me for the first part of the lecture today, which I'm recording, which is going to be the development of memory. So I thought she would be a good assistant to start with because she is exactly the right age for some of the studies that I'll tell you about. She is just 7 months now, and what I want you to think about is how on earth we would study memory in somebody who is A, as cute as this, but B, doesn't speak, do you? You don't have words yet except for dada, and can't really indicate with her hands or her body movements what it is that she wants to communicate, although I can assure you that she can be understood. But regardless of that, we can study memory in kids, and I'll show you how soon once I settle her down to go and play. As you can see, she's not going to stay with me for the whole period. But also how you would do that developmentally. So something that is of interest to Julia here at 7 months is not going to be of interest to a 2-year-old, and certainly not going to be of interest to an adult. So when babies can't talk, they can't indicate in any way an answer to your question, how do we actually study memory? Do they even have memory? Well, this is where my demonstration is going to come into play, and we'll see if it works. Kids absolutely have memory, and we can show that by, excuse me for 1 second. Here we go. You ready, darling? Okay, so look at mummy. Oh, standing up. Okay. So what's going to happen now is I'm going to count down, and she knows that once I get to 0, she gets to blast off, meaning that she gets to jump into the air and fly around in space. So normally, if the camera's not on her, she starts vibrating with excitement and grins, right? Okay, let's see. They do say don't, play with kids on video, but let's see if it works. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Are you ready? Blast off! Woohoo! Wave around in space. Hey, is that good? So she likes that. And it's not that she knows that it's coming at this time of the day. She knows as soon as I start counting backwards that that's an indication. And that is a demonstration of memory. So there you go. It worked sort of. So I'm just going to pause this and get her ready to play. Okay, so we'll skip through these slides to where I was. So we talked about the obstacles. But what I want you to understand is that there are 3 general techniques that we can use to study memory in children. They're called visual recognition memory, which is very much a paired comparison task, which you'll see how that works. Operant conditioning, which you should remember a little bit from Psych 101, and then imitation paradigms. So the first is a visual recognition memory, and as I said, it's a paired comparison task. And what that means is that babies are exposed to 2 stimulus for a fixed period of time, so 2 objects for the same amount of time, and one of those objects is going to be a novel object. And what we look for is novelty preference. That's the key here, novelty preference. Babies prefer new things. So the logic is that if they look to the new thing, then they remember that they've played with the old thing, and the old thing isn't as interesting anymore. So the setup here looks a bit like this. Obviously, this is an older child, but with an infant, they would sit on their parent's knee, and they get exposed to these images on the screens in front of them. And both, you can see here, it's the same face on both screens. And that is the familiarity phase. Now they get these strange faces. Faces are a favourite of babies, so they're a really good item to share, but we don't want human faces. We don't want faces that they've seen before, so not cartoon characters that are familiar to them, because you want to make sure that they are brand new. Okay, so this is what it would look like at test. They would be presented with the face that they'd seen before on one side and a new face on the other side. And then we would flip the screen order to make sure that they don't have a preference for looking at one screen over another. Okay, so as I mentioned, this is how remembering is calculated. Novelty preference. Infants prefer new things, except for their parents. They're always a favourite. So if they ignore the old stimulus, then we know that they remembered it. The calculation then is the amount of time the infant spends looking at the novel stimulus compared to the old stimulus. Okay. All right, so the next one then is operant conditioning. So we've talked about the paired comparison task. Operant conditioning is where you have the infant's behaviour, something that they already do. So kicking behaviour, for example, they develop kicking very early. And then you impose a consequence on it. And when we're talking about babies, that's going to be a positive consequence, something that they like. Okay, kind of a reinforcement idea. And then we observe their behaviour again and see what's happened to it. Here we have mobile conjugate reinforcement. So here what the baby learns is that they can make the mobile move. Their behaviour is reinforcing it. So the first phase is a non-reinforcement period, and that's where we observe their baseline kick rate, how much they kick when they have this little satin cord tied around their foot. So it doesn't move the mobile at this point. We just want to observe what they ordinarily do in their environment. Then we have a training phase, and now that little ribbon gets tied to the mobile and makes it move. So the baby learns that the more they kick their foot, the more the mobile moves, and they love that. So they learn quite quickly and do it more often. And learning here is defined as when the kick rate is 1.5 times more than their baseline kick rate in 2 out of 3 consecutive minutes. Okay, so it's a little bit like it's a formula, and you should try and remember that formula. 1.5 times their baseline in 2 out of 3 consecutive minutes, and that's when they've learned that they are able to make the mobile move. And then they have a test phase, and this is after some period of time. They are put back in that environment and they're tested to see how much they've retained. And there's 2 different ratios that we look for. The baseline ratio is the degree to which they exceed the baseline kick rate, how much they've remembered, and then how much compared to baseline. And then the retention ratio is the degree to which their kicking has declined since they were trained. Now, that obviously kicking behaviour is not something that you're going to see older children perform, but we can have exactly the same ratios to look for with other tasks. Now, I've just realised that this video that I ordinarily use here is probably on my work computer. If not, I will post it to Blackboard. But what it shows is this little girl here learning how to make this train move around this really amazing setup that takes up the entire room. And she learns that if she slams her hand down on a control, it makes it move. And she loves that, so does it over and over and over again. And that looks, the ratios that we can use are the same then as the mobile conjugate task. Okay, now you can pause these videos, remember, whenever you need to go, and you can go back and go over it again. So if something doesn't make sense, do rewind it. That's the benefit of an online education at this point. I will keep recording, so as you can hear my babies in the background. The third is deferred imitation, and that's the idea of monkey see, monkey do. And at this point, I know this very, very well, that babies mimic the behaviours that they see with their toys, for example, from the adults around them. Now, 12 to 18-month-olds require 1 to 2 new behaviours every day just by watching the people around them. Imitation, after a delay, is memory. If you are mimicking a behaviour that you've seen after a delay, then you remember what that behaviour was. So in this task set, the infants are required to produce a series of modelled actions without prior practice after a delay. And what it is again, it's a new kind of toy that they won't have had any experience with. In this case, a mitten toy. So the toy sits on the person's hand. And what happens is that toy has a mitten on, and in that mitten is a bell, but it's not connected at the start. So the person will then the experimenter removes the mitten, shakes the mitten 3 times to make the bell ring, and then replaces the mitten, and now it rings on the toy. So what we look for is to see if the infant can make that happen when they're handed the toy and it doesn't ring. So the baseline control condition here isn't something you need to remember. You need to remember the activity control, and that's where the experimenter manipulates the object during a demonstration session, but not the target actions. So they are just being presented with the toy, but they don't demonstrate how to make it ring. Now the test phase here is going to be either immediately or 24 hours later, and in that test phase the bell is removed. So here we look to see what happens with the child when they're presented with the same toy. Do they try and make it ring? Okay, so these are your 3 tasks that you need to remember. The next part then is what actually develops.